Good afternoon, everybody, and thank you so much for joining our webinar today, Enrollment Notices, Mastering the Method for Optimal Delivery. My name is Amanda, and I'll be your moderator today. We have ERISA attorney Larry Grugine on the line as our presenter. Obviously, in the middle of open enrollment, we all have a lot of questions about what needs to be in our enrollment notices, so today we're going to be focusing on how you can make them work for you, everything you need to know for compliance. This is a webinar chock full of information. I know it's a lot. Don't worry. We will be sending out the slides and the webinar recording after the webinar concludes, so you guys will have a great reference to look back on. In order to avoid any background noise, everybody will be kept on mute. We do have a question box right on your screen, so just type any questions in there, and I'll be happy to read them aloud for you after the webinar concludes. We'll stop at the end for questions, and then our next webinar will be on November, will be the third Tuesday of November at 1 p.m. Central, and we'll be covering everything you need to know about ACA reporting. For now, I'm going to turn it over to Larry.
Thank you very much. I appreciate it. One thing that's real important is to understand that what this seminar will do is let you know not just what notices have to be given out at open enrollment, but also what notices have to be given out at various times. So what this seminar is I divided up between various types of notices, but these are things, and this seminar is extremely important because this is one area that the DOL does audit employers on, so you should understand what's your responsibility, who gives what, when, how you have to give out these various notices, and this is what the purpose of this seminar is. So what I'm going to be doing is I'm going to be talking about, first of all, recommended and mandated participant notices for all types of plans, required notice, all plans but required annually or at open enrollment, recommended or mandated participant notices that meet certain criteria, and then mandated participant notices that meet certain criteria, which means, and what that means is, if certain things happen, for example, if somebody terminates, and a good example of that is a COBRA notice, is you have to give a COBRA notice. So I'll be talking about each one now. As Amanda indicated, we're going to be giving out the slides to you and the recording, so there's no need for me to read each of the slides. What I'm going to try to do is give you a synopsis of each slide so you can go back and look at it to see exactly the nuances of each of the requirements. So first of all, let's look at recommended and mandated participant notices, and this is for all medical plans. The first one is the Uniform Summary of Benefits and Coverage. This is the SPC, and this is something that has to be given out every year. This is a summary of covered benefits, and what's interesting about this came out with healthcare reform. If your coverage is insured, the insurance company will provide for it. There's also a summary of common terms. And one thing that at first confused people, but everybody understands this, is the fact that this SPC requirement is in addition to the ERISA, SPD, and SMM requirements. So this is an additional summary that everybody has to be given out. Now, it's given out by the either the plan sponsor or carrier. Usually the plan sponsor has to do it. Like I said, if you're insured, the carriers will prepare the SPC. If you are self-insured, the TPA or the employer has to do that. Now, it has to be given out at open enrollment. At open enrollment, at initial enrollment, these have to be given out. And generally what has to be given out, if it's a new employee at initial enrollment, they have to be given SPCs of all plans that you offer. At open enrollment, for an existing employee, you only give them what they have last year. So it has to be given out at open enrollment, initial enrollment, within 7 days after requested, or within 90 days after a HIPAA special enrollment situation. So again, please be careful because there's penalties for not providing it. And generally, how is it provided? An SPC is provided by the plan or insurer and provided in a paper or electronic form. And there is a frequently asked guidance in regard to how it's provided through distribution, through electronic distribution. Now, this is important if you don't provide the SPC, if an employee doesn't receive it, there's a penalty of $1,000 per failure. So if you have 100 employees, this could be a very, very expensive penalty. So make sure that every employee is provided a copy of the SPC. Now, this other requirement is extremely important, and this is one thing I want to spend some time on. If you decide during the plan year you're going to change benefits, and change benefit means if you're going to eliminate a plan, terminate the plan, or change any of the plan benefits during the plan year, basically what you have to do is give the employees a 60 days advance notice. So I just had a question today. Somebody wanted to terminate their HRA in the middle of the year, and they wanted to do it as of November 1st. I'm sorry, you can't do that. Because of the information on the SPC, the law requires if the change is done during the plan year, you have to give the employees 60 days advance notice. Now, this requirement right here, this updating, doesn't apply to situations where the changes are effective at the beginning of the next plan year or the policy year. This requirement only applies if the change is in the middle of the plan year. So please be very careful if you're going to make changes to the plan year, or you decide that you're going to terminate a plan, an option, you have to give employees 60 days advance notice. The next requirement is the Women's Health and Cancer Rights Act. This has to be given out. This notice is basically the right for benefits for a mastectomy. This is surgery, other treatments. The notice must describe any deductibles, any coinsurance, and there's a model notices. All medical plans have to provide this. This is provided by the plan administrator, and again, generally in this situation, it can be delegated by the employer, but again, it must be given out annually in an initial enrollment. It's usually sent at open enrollment, and it has to be sent to all plan participants. And the DOL has provided that notices must be delivered in the same manner as SPDs, which means it has to be given out mailed. It has to be electronically provided if the employees have a computer, and it also can be posted on your website. And then you basically, what you have to do in that situation is you have to give the employees a notice that that notice is on the website. So as you can see here, the plan administrator has to give this out at certain times, but generally it's given out annually in an open enrollment and an initial enrollment. HIPAA notice of special enrollment rights. Basically what this is a notice if somebody decides they're going to waive coverage, then you have to give this notice to tell them, all right, under certain conditions you can come back into the plan before open enrollment. If you have lost eligibility to a group plan, become eligible for state premium assistance, or you have a new spouse or new child. This is applies to all medical plans, and it's given out at again when somebody initially enrolls. It doesn't have to be given out at every open enrollment. So understand that. So again, this is provided by the plan administrator or sponsor. It can be delegated to the carrier and sent to and given to the eligible employees. It must be provided and delivered at initial enrollment, and also make sure and it's probably included in your SPD. And again, this notice is provided or delivered, and you can use the same methods as you do with the SPDs. Now remember, and this is extremely important, is and I get this probably all the time from employers. Well, nobody asked for this, or nobody asked for a copy of this. Well, that's not what the law says. The law says that the fact that these notices and these SPDs and SMMs have to be provided, which means even if the employees don't ask, you have to either have to mail it, hand deliver it, and get an acknowledgement, electronic, or post on a website if they have a computer. So it's got to be provided. Medicare Part D. This was extremely important because this has to be given out by the middle of October every year. And the purpose behind this is that this has to be given out to any employee who's eligible for Medicare. Now, the issue and problem is the fact that many employers don't know, because this applies to both participants and their spouses and children, and you don't know, you may not know who's eligible for Medicare. So as a safety valve, some employers provide this notice to every participant because they don't want to take any chances. And the purpose behind this is to let the employees know whether your prescription drug coverage is credible. And that's important, because if it isn't credible, then the employees at Medicare Open Enrollment has to purchase a credible coverage prescription drug program. So that's why it has to be given out by the middle of October, because it's before the Medicare enrollment situation. So this is all medical plans have to provide this. And there's two notices that have to be, that are available. One is saying, yes, the coverage is credible, or no, it's not. But again, and again, technically, you only have to be, it only has to be provided to, as this slide indicates, to Medicare eligible participants. But again, as a safety valve, you may want to think about providing it to all participants just to make sure that everybody gets it, because you may not know whether the spouse or dependents are eligible for Medicare. So, and these are the various times in this slide, slide 20, that it has to be given out. Has to be prior to the commencement of the annual coordinated election, which is October 15th, prior to initial enrollment period, prior to the effective date of coverage, whenever the employee no longer offers the prescription drug program, and upon request. So again, if the open enrollment material is provided before October 15th, then this information has to be included. And again, just like any other notices, it can be provided by paper or electronic means. CHIP notice. A little side note on the CHIP notice. The federal government has not authorized the continuation of the CHIP program. So we should know in the next few weeks whether this program will continue, whether the CHIP notices have to be continued. The purpose behind this one, it informs employees of possible state assistance to help with payment of for children for health insurance coverage. And you have to be given out for all plans if participants reside in a state where the CHIP assistance is provided. Is provided by the plan sponsor and sent to all employees in the state listed in the CHIP notices. Not all states are participating in that program. It's delivered annually. Recommended to include an open enrollment material and upon initial eligibility, and there's a penalty of $100 per day for an employer to failure to meet this requirement. But again, just know that there may be at this program, we should know the next few weeks whether this program is continued. The funding for this, it wasn't renewed, and the Congress didn't do it. So again, everything is up in the air at this point. Newborn Mothers and Health Protection Act. This basically is to let everybody know that in regard to childbirth, 48 hours for a child, 48 hours for vaginal delivery, and 96 hours for cesarean. All plans have to give this notice. And this notice is not a separate notice. information on this has to be included in the SPD, sent to all plan participants. And so whenever the SPD is delivered, that's when this notice has to be included. So it's not a separate notice. It's just included in the SPD. Now, the next series of notices are not required annually in open enrollment. There could be special events that the notice has to be given out. And the HIPAA privacy notice. Now, the HIPAA privacy notice either is a carrier's privacy notice or a privacy notice of an employer that has access to PHI. So it tells plan participants exactly what their HIPAA privacy rights are and what the employer is going to do. So it's all health plans that are subject to HIPAA. If it's an insured plan, the carrier must send all plan participants if the employer does not receive PHI. If the employer does receive PHI, they must have their own HIPAA privacy notice. It must be delivered at initial enrollment, and then after that, every 3 years, the employer must give an employee a notice of their right to resend the new notice and to receive a new notice. So basically what this does, it just informs the employees of their right in that situation to request the HIPAA privacy information and also what the employer is going to do with that information. Exchange notice. This is a notice of coverage. This only has to be given out at initial enrollment. And what's interesting, if you don't give it out, there's no penalties. The employer has to give it out to all new employees, either full-time or part-time, indicating the availability of the marketplace. It has to be given out within 14 days of hire. So again, this is information. It only has to be given out once when that person is first hired. And the DOL has a model notice that you can use. There's one notice if you do provide coverage and another notice if they're not eligible for coverage. So it tells them exactly what their rights are on the marketplace. So again, just be warned the fact there's no penalty on this if you forget to send, but again, it's just given out at initial enrollment. COBRA initial enrollment, or it's called the general notice, this has to be given out within 90 days. Has to be given out to all plan participants. The DOL has a model initial notice, so it has to be given out when you give out the summary plan description. There has to be an initial notice that also has to be given out. So again, it's given out by the plan administrator. And it's a separate notice that basically what this notice does, it's a summary of what COBRA is and what the rights under COBRA are. It's a general discussion of COBRA, and that's what the purpose behind this is. It's just to inform new employees that, hey, COBRA's out there. In case you terminate, you can continue the coverage. So again, this is just a general summary of COBRA. The other COBRA notice is the election notice. There is a model election notice. This election notice is given out when there's a qualifying event and a loss of coverage. It must be given out by all plans that are subject to COBRA. So again, in this situation, the plan administrator must provide a COBRA notice to any qualified beneficiary within 14 days after the plan administrator has been notified that the qualifying event has occurred. So again, and many times employers have COBRA administrators, as soon as they get notified, they send the notice out very quickly. And this basically indicates to the employee what their rights are under COBRA, what coverages they have, because remember, under COBRA, you can only, at the time of the qualifying event, continue coverage that you had at the time. And there's also a summary of what their rights are under COBRA when you do elect COBRA, and also tells everybody when the premiums are due and what some of the restrictions are. So this is an extremely important notice. But again, it's only triggered by a qualifying event, and this notice has to be given out to qualified beneficiaries. Notice of termination of COBRA coverage. Basically, when COBRA coverage ends before the maximum period, because, for example, you haven't, that person hasn't paid their COBRA premium, then you have to give a notice of termination. And these are all of the events that this notice has to reflect. The fact that the COBRA premium has not been paid, the employer ceases to provide any group health coverage, the qualified beneficiary becomes covered by another plan, the qualified beneficiary becomes entitled to Medicare. It's a disabled qualified beneficiary whose disability caused an extension. Now they're not deemed to be disabled, or the qualified beneficiary's COBRA notice was COBRA coverage is terminated because of cause. In each of these events, the COBRA administrator or the employer has to provide a termination notice to the employees. So it's applicable to all plans subject to COBRA. The plan administrator or a COBRA administrator has to do it. And this notice has to be furnished by the plan administrator as soon as following the decision to terminate coverage. So again, it doesn't have to be given out at the end of the 18 or 36 months, but if it's terminated early, this notice has to be given. Now, this is a fairly rare notice that has to be given out. This is a situation where somebody has applied for COBRA, and for one reason or another, they're not eligible for COBRA. So basically, what the COBRA administrator has to do is tell the individual, I'm sorry, you applied for COBRA, but for one reason or another, you're not eligible. It could apply for someone, they may have a loss of coverage, but there's no qualifying event. It could be a domestic partner who thought they would get COBRA and they applied, and it doesn't apply to domestic partners. So there's several reasons why somebody would apply for COBRA and they would not be eligible for COBRA, and that's the purpose behind this notice. So it's provided by the plan administrator. The notice of unavailability is required if the plan administrator receives one of the following notices. A notice has occurred, the notice the second qualifying event has occurred, and the notice has determined that the Social Security Administration. But again, in that situation, if the COBRA coverage is not available, you have to give this out. This is not given to participants as a qualifying event notice to the plan administrator. The plan administrator must be notified when a qualifying event has occurred. This is a responsibility between the employer and either the plan administrator or the COBRA administrator, and this has to be given out. This notice, the employer has to notify the plan administrator of the qualifying event. So the employer has to provide it, and the employer must notify the plan administrator of the death, termination, becoming eligible for Medicare, or commencement of bankruptcy, and it must be given out within 30 days after the qualifying event. The next category is recommended and mandated participant notices that meet certain criteria. So the best way to remember this series of notices is the fact that only under certain circumstances will these notices have to be provided. And this is under wellness programs. It only applies to certain types of wellness programs. It basically tells eligible individuals they can satisfy an alternative standard. Now, what's interesting about this notice is provided by the plan administrator, sent to all participants. And it doesn't have to be specific. It has to be delivered annually in an open enrollment or prior to the offering of a wellness program. What's interesting about this notice, it doesn't have to be give any specific details of what those alternative standards are. Now, what does this mean, alternative standard? In many wellness programs, in order to gain a reward under a wellness program, what you have to do is meet certain standards. And under the HIPAA regulations, it says, well, if a person can't meet those standards, the employer has to notify the employee that there's alternatives that are available to in order to be eligible for the wellness benefit, and they have to be available. And what's interesting, they said that in these notices, you don't have to be specific about what those alternative standards are, because they have to be individualized for each employee. So all this is a notification that alternative standards do exist, and come on down and we'll tell you about it. That's basically what it says. So again, it's done annually in open enrollment, and it's again prior to the offering of the wellness program. Now, in addition to that, in 2016, the EOC created a new notice. It tells individuals what information will be collected, how it will be collected, and how it will be kept confidential. Applicable to wellness programs that collect health information through health risk assessments. Has to be provided by the first day of 2017, and thereafter participants must receive it annually. And there's a model notice that the EOC has actually created. So if you're sponsoring a wellness program, you have to make sure every year this notice is given out. Summary annual report. The summary annual report is given out each year, but it's only required if you file a Form 5500. So this is an annual statement summarizing the latest annual report 5500. It's applicable to all employers that file a 5500. It's provided by the plan administrator, sent to all participants, and basically just summarizes the information on the 5500. And it must be given out annually within 60 days after the filing of the Form 5500. That's 9 months after the end of the plan year. So once you file your 5500, then it's due. Just understand that there are a model language in the regulations that you can use, and you just fill in the blanks and send out to the participants. Form 1095C, the Form 1095C is provided each year. Next month we're going to have a seminar on the 1095C, but this is just an introduction. This has to be given out every year. It tells individuals for what months they're offered coverage, and whether that coverage was affordable coverage. It's only applicable for large employers, 50 or more. It has to be provided by the employer. Employers can use any vendor to actually provide for this. It has to be given out to the employees this year by the end of January 2018. And there were not that many changes from last year. So far, there's no indication that January 31st date is going to be extended. So there's been no indication. Now, this has to be given out, sent to all individuals who are full-time employees at least 1 month of the previous calendar year. And whether they're offered coverage or not, if they're full-time for a month, they have to be given a copy of the 1095C. And this information is used to see if individuals are eligible for credits and subsidies on the exchange. That's the purpose behind this. And also, it is used to determine whether any applicable large employers are going to be penalized. So so it's an extremely important. This requirement is one of the more complicated notices I've ever seen. It is extremely complicated. So again, this year it has to be delivered to the employees each year. This year it's going to be delivered. It has to be provided by the end of January of 2018. Next is mandated participant notices, plans that meet specific criteria. Patient protection provider choice disclosure. One of the requirements of the Affordable Care Act, this notice tells participants they can designate a pediatrician as a primary care physician and that no referral is required, is given out by the carrier or the plan, and is applicable to non-grandfathered plans. It has to be provided annually with the carrier certificate of coverage, and I just wonder how many carriers are doing this now and how many employers are doing this. So again, in that situation, if they can designate a pediatrician. Breach notice, a breach is involving 500 or more than 500 participants. This notifies participants and the HHS there was a breach of protected health information. It's applicable for all plans that had a breach. It must be provided to by the plan sponsor and must give notice to the affected participants and directly and to the HHS. It must be given out without reasonable delay, but not more than 6 days after notice of breach. And this is extremely important because there are certain criteria that you have to meet in order to determine whether you have actually had a breach. If you do have a breach and more than 500 people have been affected, this notice has to be given out. If a breach was 500 or fewer individuals, you still have to notify participants in HHS, applicable to plans that had the breach of PHI during the plan year or during 60 days, during the past 60 days. It has to be given out by the plan administrator, must provide notice to the affected individuals, and delivery is within 6 days after the end of the plan year. So it's a little bit different to HHS, but you still have to give notice not more than 60 days after the discovery to plan participants. So it's a little bit different than the other notice. The other one, you have to give notice to HHS as soon as possible. If it's less than 500 people, you still have to give notice, but it's 60 days after the end of the year. General notice pre-existing condition exclusion explains the plan's pre-X. Not that many plans. I still have a pre-X condition applicable to small insured plans that were allowed to renew as non-compliant. So most plans will no longer provide this notice because there's no longer pre-X, and it was applicable up until the 2014 year. But if you still are, again, a plan that's non-compliant, it must be given out at initial enrollment, open enrollment, and the SPD. Grandfather notice. Grandfather notice, what you have to do to maintain grandfather status, a plan must provide materials describing benefits for participants and beneficiaries. And generally, what you do have to do, you have to make sure in material that if it's in the SPD or separate notice, but you do have to notify your employees every year whether your plan is grandfathered. I advise most employers in this situation to provide the notice in the SPD. If you don't give out an SPD, if you don't have an SPD, make sure employees are notified each year what your grandfather status is. So again, it's provided by the plan administrator. This disclosure requirement applies to any SPD, SMM, or a benefit enrollment for plan years beginning after September 23, 2010. And the agencies have clarified that it's not necessary for grandfather plans a disclosure statement regarding its grandfather every time it sends out a communication. It just has to be done once a year. Amanda? Are there any questions?
We have some great questions. But first, just a little bit about benefitexpress. Thank you so much for joining our webinar. We're a benefit-wise, relationship-driven company. We help our participants understand and use their benefits wisely so they can be accountable for their health care. And then we enable you as the plan sponsor to help deliver your benefit strategy and communicate it with enrollment notices like this. and just a quick summary of our services on the left side. And then Larry, if you could hit the next slide,
sure.
Please. Here's a little bit about our company background. We have 250 employees. We serve our clients from 2 service centers here in Schaumburg, Illinois, and then back in Rancho Cordova, California. We support over 226 mid and large administration clients, and our average client size has over 4,000 participants. Here's a little bit more about us. And then one more slide, please. And here's a little bit about who we partner with. We integrate with Optum, Summit HR and Payroll, so we do offer payroll with some of our solutions, as well as Highland, USI, and Connor Strong. So Larry, we do have some wonderful questions for you.
Okay.
First one I have here is, if an integrated HRA is administered by a TPA and not the medical carrier, and the medical carrier SBC does not mention the HRA, is an SBC required for the HRA?
Yes, yes, there is. And I've created, if you're interested, Amanda, I'll send it to you. I have a separate SBC for HRAs. I've discovered that, especially with integrated HRAs, that if you try to fit the HRA into that 8-page sheet, it wouldn't make any sense to the employees. So what I've created is a special SBC for HRA, and I'll send it to Amanda. Amanda, why don't you send it out?
Absolutely.
And it basically contains the same information as you would under the SBC, but it's organized so the average employee can actually understand it. I think it's extremely important. So it contains all the information that explains. So it's a short summary of what the HRA is, and I think in that situation, once you see it, you can understand why I've created it that way and why I organized that way, because the average participant won't understand it if you try to fit all that information in the chart that the government's provided.
I think that makes sense. And then the other question is, when will we know more about the CHIP program?
It should, I would give it another month if the Congress does renew it. It fell through the cracks of all the fighting that's going on in Congress right now with healthcare reform and tax reform, so it kind of slipped through the cracks. So there's a bill that's going to be introduced very soon to extend it, and let's see how far it goes. But again, I think it ends, November 1st, if I'm not mistaken. But again, so we should know very quickly whether it's going to be extended.
All right, thank you so much. I'll remain on the line for a couple more minutes in case there are any questions, but otherwise that's the end of our presentation today. Thank you all so much for joining us. And again, our next webinar will be on the 3rd Tuesday of November. We'll have a link to register in the follow-up email you'll be receiving shortly. Thank you all so much for joining us.
Take care.